When I started using MyChart, I found that I had a big sigh of relief because I felt like I was no longer solely responsible for keeping track of everything to do with my healthcare, whether it was appointments I was keeping track of or, again, like blood test results, messages from specialists. I was really excited to hear that it would kind of all be in one space. I've been a patient in and out of hospitals in Hamilton probably since I was about 13. My healthcare journey began when I was diagnosed with a blood disorder at a young age, and then I had a splenectomy, so my spleen was removed. And then after that, I've had a few different episodes with sepsis, so infections where I got really sick. One time, more recently when I was 30, so about 5 years ago, I ended up in a coma for a couple weeks. On dialysis for almost a year. It really required me to maintain good communication with various specialists and to keep track of a lot of information for over a long period of time, and to make sure that my doctors and specialists were also keeping track of the same information. So I actually found myself for many years, I actually have a binder that I had created, and I actually would go and I would print out all my different blood results and visits and readings, and I would bring them with me to visits because one doctor would not necessarily know things that maybe the other had seen and vice versa. So it really, I think as a patient, required me to be very organized and to kind of keep everyone in the loop. I'm no longer chasing doctors and specialists to get test results and appointments. I feel like overall it is giving me a sense of empowerment.